We all know about contractions, right? I mean, at least essentially you know about contractions. You might not know exactly what they expect, but how do you really know you're in labor? Is it just contractions that you're looking for, or is there more? That's what we're gonna talk about today on The Pregnancy Nurse. I'm Hillary, I am the pregnancy nurse, and I am the curly head behind the website Pulling Curls, as well as the online prenatal class for couples. I have been a nurse since 1997 in various fields, including geriatrics, hospice, pediatrics, and I have 20 years of labor and delivery experience, which has been to prepare you from bump to bassinet for what to expect for your new baby. I am here to help you have the confident, collaborative delivery that you are looking for, and today we are going to talk about how to know if you are in labor. That's going to help you feel confidence because you're going to know a little bit more what to expect. Now, if all of this makes you like, there's so much to think about, I have a full online prenatal class that you can check out through the show notes that explains all of it. We're going to also even give you the equation to know if you should go to the hospital to have your baby. If you like videos like this, please sure and like and subscribe so that YouTube knows you are interested in knowing more about your labor and delivery experience. Okay, everybody knows about contractions. You've heard from your friends about the pain in your belly. We're going to talk about those more in an upcoming video, but today I want to talk to you about 5 signs that you can look for beyond pain in your belly that can tell you if you are in labor. Now, a lot of people don't know about these signs, so I'm excited to share them with you here today. And at the end of the video, I'm going to give you a big tip on what you can do to know if you are in labor. It's something really simple, something you totally have at home. Stay tuned. Of course, if you think you're in labor, if you have any questions at all, you should always call your doctor. This is just an entertainment video, not medical advice. Okay, let's jump into it. The first tip is stomach upset. Now, your stomach and your uterus are not tied together, but sometimes Mother Nature has created your stomach to clear itself out, as well as your intestines, to give your baby more room to come out, because your intestines actually do run right by your vagina. So if you clear those out naturally, it does give your baby a little bit more room. Now, we don't do enemas anymore in the hospital, in case that is a question you have, but usually if you go into natural labor, your body clears it out on its own. So of course, you could have those stomach upsets from the Chinese food you ate last week or just being pregnant. A lot of people's stomachs are kind of different while they're pregnant, but it can be a sign of labor if it comes on all of a sudden and it doesn't seem related to what you ate. Number 2 is discharge changes. Now, I hate to say it, but your underwear may even get a little bit moist as you head into delivery. That's just because things are really happening down there with your cervix, and so I definitely recommend that people wear a pad as they go into labor because you're going to be more comfortable, and you may even need to change that out every 4 hours or so. Sign number 3 goes along with that. It is losing your mucus plug. Now, most people lose their mucus plug in the toilet. So after they go to wipe, they'll just notice that there's mucus in the toilet. It is exactly as it sounds. It is dried mucus along with some older blood, which is usually brown. You find it in the toilet. I personally found mine very gross. So just something to keep in mind. Now, a lot of people come into labor and delivery and they say, Hillary, I've lost my mucus plug. It's time to have the baby. Not true. Just because you've lost your mucus plug doesn't mean that the baby's coming right away. It does mean that you will probably have your baby in the next week to month. So some people lose their mucus plug even early and then it replugs itself up. The mucus plug is actually a fascinating thing, but it's so gross, I don't think I'm going to really go into it today. Sign number 4 is bleeding. A lot of these are obviously coming from the same area. It is normal to have some bleeding as you go into labor. Now, some of that can be bright red. You should not have large amounts of bright red bleeding. I would definitely talk with your provider about what's expected for you. Some of that may depend on your placenta and how things are going, but some amount of bleeding isn't unusual as you go into labor. It also isn't unusual to have a little bit of bleeding after your doctor checks you in the office. That means bright red or dark brown. So small amounts of bright red are okay. Larger amounts of darker brown bleeding is normal. Dark brown blood is stuff that has been in there for a while, and so it's not actively bleeding, it's just what's been hanging out up there. Sign number 5 is radiating pain. So you might have stabbing pain in specific areas. That is not usually labor. Talk with your doctor if you have that issue though. But when it starts to radiate, it seems like it's your belly going into your back or your belly starting low and then moving up, or your belly starting high and then moving down, a lot of times that can be a sign of labor. Labor is getting that entire area because your uterus fills most of your abdominal cavity by the time you go to have your baby. The reason you have radiating pain is because your uterus takes up most of your abdominal cavity at this point, and so all of it is getting involved. You've got muscles of the back, you've got muscles in the front, you've got your uterus, they're all contracting, and so it's that entire abdominal area that you will notice being uncomfortable when you have a contraction. Here is time for the big tip. So you think you're in labor, but you're not really sure. What should you do to really know? Drink 3 giant glasses of water. I don't mean tiny ones, I mean big glasses of water. A lot of times false labor is started because you are dehydrated, especially if it's summer. We're heading into the summer months right now. And so being hydrated is really important to tell if you're in actual labor that is going to make your cervix open, or false labor that's just making you uncomfortable. Now, of course, you're gonna pee a lot after those 3 giant glasses of water, but I promise you, you're gonna feel better. And in fact, if you are in labor, those are really gonna hydrate your veins so that you can have an easier IV placement process, which I have a video on that I will link here as well. So those are some of the signs of labor. If you like this video, please subscribe. Also, check out some of my other videos that are gonna come up on the screen next. I have lots of videos about helping you have a collaborative hospital delivery that you desire, and I think you're gonna like those too.